Hi, my name is Dr. Justin Dorenzo. I'm a clinical and forensic psychologist in Jacksonville, Florida, and I'd like to welcome you to our 4-hour anger management course. It's based on largely the work that I do in private practice in dealing with court-ordered and self-referred clients and patients who come to see me for anger management type work, and I use a great deal of information as well from the Substance Abuse and Mental Health Services Administration Anger Management Manual that's been empirically validated and been published several or edited several times over the last decade, and I find it to be very effective and a helpful framework. The course is designed to be done in 4 hours at a minimum. It's based on 10 sessions. At the end of each session, you will have an exercise to complete or several exercises to complete. There are 2 ways to gain your certificate by the end of the course, and that would be by either submitting to me all of the information from all the exercises, your responses to the exercises, or taking the final exam at the end. So it's up to you. So the materials that you'll need for the test, if you plan to submit the documents to me, or at least your exercises, the best thing to do is to use Word or some type of word processing program so you can electronically submit that to me. If you don't want to submit that to me, then certainly a physical notebook would do just fine. But I would like you to I would like you to track your progress along the test, so don't use loose papers and things like that, but have a notebook so you can keep all of your exercises together. And again, you certainly don't have to submit that to me to get a certificate for the course. You can simply take the final exam at the end of the course. So let's begin. Let's first understand what anger is, and we need to understand the myths and also the anger meter in session 1. So there's a difference between anger and aggression. Let's find out what's the difference. So what is anger? Anger is a natural emotion that starts as a little irritation and has the potential to grow into an internal rage. Anger is natural and often leads to irritation. That irritation part just happens. Obviously, if we could choose to avoid irritation, we would certainly do it. It's not very comfortable. Anger can be triggered by the regular frustration of life, like situations where our needs or goals are not met. Feeling threatened or believing harm will come to us or the people we are close to. So it is important to understand that anger is not a behavior, it is an emotion. Anger becomes a problem when it is felt too intensely and too often, and when it leads to negative consequences. So again, I want to stress that anger is it's not a behavior, it is an emotion. So what's aggression? Well, aggression is an unnatural behavior that attempts to express this overwhelming emotion of anger. So aggression is an unnatural behavior simply because we choose to act aggressively. So it's a choice to be aggressive rather than just to have the emotion of anger. So we choose to act aggressively because it gives the illusion of relief. It provides relief by releasing tension and by controlling others solely because they are afraid of some act of violence that we may turn toward them. In the long run, aggression and other ineffective behaviors only make the problem worse. So sure, we may feel better after acting aggressively, but everybody else involved does not, which will only promote more reasons to become angry in the future. So very interesting. People often come to me about myths about anger. They certainly have different beliefs and values about how they see anger and what is the cause. So I think this is often helpful because I think this often feeds into maybe our denial or justification of why we're angry when we do believe or understand, when we do believe some of these myths. So hopefully I can convince you that maybe some of your past beliefs about anger are in fact myths and not founded on truth. So hopefully this will help. Anger is automatically followed by aggression. It is often believed that aggression comes with anger automatically, which is understandable. If our emotions are relieved, we must be doing something right. However, we are just postponing those emotions. So if we think about ways to express anger as different tools, aggressive behavior is just the only tool we have, and we have become good at using it. So it's very possible to learn how to use new tools so that we are better equipped to express anger. These tools include assertive skills, positive and gentle self-talk, and promoting rational beliefs. So we're going to learn how to do these things, and we'll also learn to use the right tools in different situations. For example, we wouldn't use a screwdriver to hammer a nail. So we are going to, anger. We're going to learn how to not use anger. We're going to understand that it's okay to feel anger, but it doesn't certainly need to lead to aggression or vice versa. So, number 2, people must be aggressive to get what they want. When it comes to getting what we want, it is believed that we have an ultimatum. Either be aggressive and get what we want, or do away with aggression and never get what we want. What if there was a way to get what we want without having to act too aggressively? Well, the answer is assertiveness. Assertiveness is a way of expressing our irritation while being respectful and showing how you would like the situation changed. This form of communication keeps the attention focused on the situation and not the person. So, it's a tough one. People that have grown up in a difficult environment often feel that the only way they can get their needs met is to bully, and we need to find other ways, because yes, sometimes you may be able to get your way, but you create other hostility, and there are from the other parties, and there's certainly other consequences to bullying and to being aggressive to get what you want. Anger is inherited, number 3. If we believe this to be true, we just bought one. So a one-way ticket to being an angry person for the rest of our lives. This myth requires us to believe that our anger is a fixed trait that cannot be changed. So, yes, anger runs through families. It's likely more of a learned behavior than an inherited one. We certainly model our parents and figure out how to behave by what our parents do and how they respond to anger. But again, it's not an inherited trait, it's something learned. So instead, research studies prove that anger is a learned process, which implies that we're able to learn new effective ways of expressing anger. Yes, it may be true that our mother or father is an angry person, but that does not mean we inherited an angry trait. It just means that we learned how to be angry through observation. All right, number 4, venting anger is always desirable. Again, venting anger, screaming, hitting pillows, etc., does not give, venting anger does give the illusion of relief in a moment. However, it just reinforces aggressive behavior, which harbors those angry feelings. And again, some of the work that I do a lot of marital therapy, and people want to come in and they feel like they need to vent back and forth, and I need to be heard, and I need to scream and yell at you, and then I'll feel better. But what I have found in the clinical practice, as well as what I have read in the research, that venting is ineffective. It just engenders even greater hostility and more anger. So we need to find other ways to vent, not directly vent to people. So we need to be using exercise and like actual physical exercise and breathing and other things to manage the anger rather than just venting it. So again, even mental health professionals accept this myth for a while, but they realize that patients are just learning how to escalate their anger and how to act aggressively. So let's talk about breaking the habit of anger. Well, we know that anger is habitual, so we know that we can learn new habits, right? So the more time we spend letting our irritation escalate in anger, the more familiar that pattern becomes. So the more we act this way, the more likely we're going to use anger. So it becomes so familiar to us that we don't even think about it anymore. It just happens. Our brain recognizes that we are irritated, and without thought falls back into this familiar pattern of anger. So how to break this habit? What do we do? Well, you got to be aware of when anger is escalating. So the first step that we can take toward nipping anger in the bud is recognizing situations and actions individuals make that usually make them angry. So then stop the usual thought pattern. So we got to tackle it first by changing our thought pattern. So the old saying goes, if we do what we've always done, we'll get what we've always gotten. And that certainly holds true. You got to make a stand today that you're going to break this habit. So talk about strategies for controlling anger. So unfortunately, becoming aware of our anger is not enough, right? And awareness is not enough. Certainly you have to admit that there's a problem, know that there's a problem, but there's still further steps to be taken. So we still need to develop tools. These strategies include breathing exercises, thought stopping, and a timeout. The most effective strategy to put to use this early in treatment is the timeout. So that's what we're going to focus on. And a timeout is used when we recognize that our angry emotion and thoughts are beginning to escalate. We should simply tell ourselves to take a moment from the issue, stop thinking about it, and remove yourself from the situation. So we know that specific thought stopping, like if I told you to stop thinking of a pink elephant, then you would certainly have a pink elephant in your mind. But the best thing to do with timeout is really distraction, and that's why we say, a psychologist will say, it's important to count to 10 when you're angry. Count to 20 or count to 100. It's really to distract you. So it's a timeout and a distraction, and it can help to remove yourself from the situation and count. Like if you're angry at a child or a spouse, to step out of the room, not permanently because you got to deal with the issue at hand, but to calm down first before tackling whatever the issue is. So let's talk about the anger meter. You're going to be using this throughout the sessions and in between sessions to basically to track how intense your anger has been over the few days between each session, or over the week or weeks between each session, depending on the speed of which you're taking this course. So a great way to become aware of our anger is to identify and to understand it by using the anger meter. So the anger meter works by rating our level of anger on a scale of 1 to 10. So a 1 being not angry at all, to at all, completely, so that's completely controlled and calm, and then a 10 being very angry and receiving negative consequences. So basically 1 through 9, if we look at the anger meter, 0 is completely calm, no anger. 3 is some anger, some irritability. 7 is increasing anger, losing control. And then we get all the way up to 10, explosive behavior, violence, loss of control, negative consequences. So basically 1 through 9, or 0 through 9 is not losing control yet. Just as we increase the number, certainly the feeling becomes more intense. So the way we scale our anger is completely up to us, as long as we understand that a 1 is completely calm, or a 0. 1 or 0 is completely calm, and a 10 is very angry and receiving negative consequences. So I'm going to have you use this anger meter for the exercises for the first session. So let's talk about what I want you to do following the conclusion of this session and over the next few days. So for this exercise, you'll need a small notebook and pen, or computer tablet, or some type of word processing document. For the next couple of days or weeks, I would like you to rate your level of anger every time you notice that you're in a situation of stress. I'd like you to write down the situation and your level of anger according to the anger meter that you learned about. I would also like you to reflect upon the myths about anger that you have learned, especially following any episodes of anger that you experience, and write a few sentences of reflection about them down in your notes as well. So it's important whenever we're changing to spend a lot of time reflecting and self-correcting. So what we know from psychological studies is just the act of monitoring one's behavior will improve one's behavior. We pay more attention. We're certainly more self-aware. It's why All of these are many exercise programs as well as weight loss programs. They have you document and keep track of what you eat, how many times you exercise, because you just by seeing what you're doing, you certainly reinforce good behavior, and then you also, you don't want to write. So you don't want to write negative things about yourself either. So in the moment of anger or upsetness, or if we're talking about diet, of wanting to eat something, you think to yourself, I really need to keep track of this, and I don't want to write a high number. So I'm going to control my anger, or how much I eat. So it can be very, very effective. So once you complete the exercises, you have successfully completed session 1.